Welcome to Pharmoon Drops. This playlist deals with multiple choice questions asked in various competitive exams and their answers with a brief description. This is the first question. The sweetener which is carcinogenic is saccharin. Saccharin is a carcinogenic sweetener. Sweeteners are classified into nutritive sweeteners and non-nutritive sweeteners. Examples for nutritive sweeteners are sugar alcohol such as sorbitol, mannitol, lessitol, etc. Examples for nutritive sweeteners are sugar alcohol such as sorbitol, mannitol, lessitol, etc. Fructose and sucrose are also nutritive sweeteners. Fructose and sucrose are also nutritive sweeteners. Examples for non-nutritive sweeteners are aspartame, saccharin, cyclamate, alletame, etc. Aspartame, saccharin, cyclamate, alletame, etc. are the examples for non-nutritive sweeteners. These non-nutritive sweeteners are artificial sweeteners. These non-nutritive sweeteners are artificial sweeteners. 100 milligram of desferrioxamine can chelate 8.5 milligram of ferric ion. 100 milligram of desferrioxamine can chelate 8.5 milligram of ferric iron. Desferrioxamine can be administered during iron poisoning. Desferrioxamine is the antidote for iron poisoning. The routes of administration of desferrioxamine are intravenous, intramuscular, and subcutaneous. Routes of administration of desferrioxamine are intravenous, intramuscular, and subcutaneous. Denaturation of protein leads to precipitation of protein. Denaturation of proteins leads to precipitation of protein. Due to denaturation, liquid state of the protein is converted into a solid state. Due to denaturation, liquid state of the protein is converted into a solid state. Denaturation is the process of loss of native conformation of a protein structure. Denaturation is the loss of native conformation of protein's structure. Structure of protein contains both hydrophilic and hydrophobic amino acids. Structure of protein contains both hydrophilic and hydrophobic amino acids. The normal conformation of proteins try to hide the hydrophobic amino acids in the core of the structure. The normal conformation of proteins try to hide the hydrophobic amino acid in the core of the structure. When these proteins are denatured, the hydrophobic residues are no longer hidden. When these proteins are denatured, the hydrophobic residues are no longer hidden, and the proteins become less soluble. Due to this, the proteins become less soluble. This leads to its precipitation out of aqueous solution. This leads to its precipitation out of aqueous solution. Denaturation is an unfolding of hydrophobic amino acids. Denaturation is a unfolding process of the conformation which expose the hydrophobic amino acids. Platelets are non-nucleated cells. Platelets are non-nucleated cells. Platelets are formed in bone marrow. Platelets are formed in bone marrow. Platelets are able to liberate platelet factor. Platelet factor is liberated from platelets. Neutralization test is generally used for the diagnosis of viral infections. Neutralization test is generally used for the sero-diagnosis of viral infections. But it can also be used for the detection of other pathogens or their toxins by identifying the antibodies. It can also be used for the detection of other pathogens or their toxins by identifying the antibodies against them, which means neutralization tests are based on antigen-antibody reaction. Neutralization tests are based on antigen-antibody reactions. Eosinophils are weak phagocytes. Eosinophils are weak phagocytes. Eosinophil shows chemotaxis. Eosinophil shows chemotaxis. Chemotaxis is the movement of inflammatory cells to the site of infection due to the attraction by different chemicals. Chemotaxis is the movement of inflammatory cells to the site of infection due to the attraction by different chemicals. Eosinophils can release lysosomes. Eosinophils can release lysosomes. The percentage or count of eosinophils in the circulation is very less. The percentage or count of eosinophil in circulation is very less. The active proteolytic enzyme in gastric juice is pepsin. Pepsin is the active proteolytic enzyme in gastric juice. Polyamide sutures are synthetic non-absorbable sutures. Polyamide Sutures are synthetic, non-absorbable sutures. Schedule V of the Drug and Cosmetic Act gives the standards for the patent and proprietary medicines. Schedule V of the Drug and Cosmetic Act gives the standards of patent and proprietary medicines. Let's see the other schedules in Drug and Cosmetics Act. Schedule A is related to forms and application. You remember the letter A. Letter A remind you about applications. Schedule A is for applications. Schedule B is related to fees for the test or analysis by the central drug laboratory or state drug laboratories. Schedule B is related to the fees for the test or analysis by the central drug laboratory or state drug laboratories. It can be remembered by this technique. You remember a word buying. Schedule B is about buying of a service. To buy a service from the drug laboratories, we have to pay a fee. Schedule B is related to buying that service and payment of the fee. By connecting B with buying, you can remember about Schedule B. Schedule C deals with biological and special products, and Schedule C1 deals with other special products. Schedule C is related to biological and special products, and Schedule C1 is related to other special products. Schedule E1 is the list of poisonous substances under the Ayurvedic, Siddha and Unani systems of medicines. Schedule E1 is the list of poisonous substances under the Ayurvedic, Siddha and Unani system of medicine. The person expired after taking the poison. Expired means dead. From the word expiry, you can remember Schedule E. Expiry start with E. And you can connect the poison, expiry and Schedule E together. While hearing about Schedule E, you remember about expiry. When expiry happens, the person expires when he takes some poison, which means Schedule E is for poisons. Schedule FF is related to ophthalmic preparations. Schedule FF deals with the standards for ophthalmic preparations. You remember it by the pronunciation F. The word ophthalmic contains a pronunciation F. From this F, you remember that this is dealt in Schedule FF. Schedule G is the list of drugs that should be used only under medical supervision. Schedule G is the list of drugs that should be used under medical supervision only. Schedule H is the list of prescription drugs. Schedule H is the list of prescription drugs, which means Schedule H drugs can be sold under the prescription of a registered medical practitioner only, which means Schedule H drugs can be sold to a patient under a prescription of registered medical practitioner only.